So I wanted to start today just with like a fun poll question. Tita, will you put up the question about the percentage of folks who need their wisdom teeth removed? So just curious what you guys think. What percentage of people will end up needing their wisdom teeth removed at some point in their life? I'll just give folks a couple more seconds to choose an answer. All right, so it might surprise you. A couple of you were right on the money. 85% of people will end up needing their wisdom teeth removed at some point. So this is a very common occurrence, and it's very common for people in the age range that grad employees usually fall into. So this is something you should pay attention to because it definitely could happen to you in the next couple of years when you're with us at UMass. And we're going to sort of give you the map of how you would navigate the insurance to come out with the best outcome for yourself if it does happen to you. I know it happened to me when I was a grad student at UMass. I had to have my wisdom teeth removed. It's very, very common. So usually you'll start by having some sort of jaw pain. You'll have swelling in your gums. You'll go to the dentist. They'll identify that you need your wisdom teeth removed. That is sort of the first step that happens. And then once you identify that you need your wisdom teeth removed, you're going to want to check up on your insurance coverage because, like we said, you have 2 insurance plans that are in play potentially when you have your wisdom teeth removed. So you want to make sure that you are giving that plan information for both plans to your dentist, because if there's coverage there, then you'll access that coverage. If you, and this does happen, and we have to help people kind of go back and start the process from the beginning again. If you only show up to the dentist with your WellFleet information, typically that is going to be a non-starter because there is not a dental plan that is part of your, like a full dental plan that's part of your student health plan. And we sometimes see folks who come and they go to the dentist, they give their WellFleet card and they're like, I don't understand. There was no coverage. I had to pay the full bill. That's because that's not the dental plan. The dental plan is through Altus, and you enroll in that plan through the trust fund. Then you have your separate student health plan, which has a dental component. So to be safe, give them both plans, especially if you have wisdom teeth that are going to be removed. Just give them your WellFleet card and your Altus card. Explain that you have a student health plan and a dental plan. That will cover all your bases. All right, so a couple of terms that we want to go over. We try to always explain acronyms because we don't want to be throwing around jargon that just goes over everyone's head. So in-network and out-of-network, you'll hear us say quite a bit today. In-network means that the dentist has negotiated rates with the insurance company. Out of network, they don't have an agreement about the charges that they have. And so you're usually, your best bet is to stay in network when you need to. A deductible is the amount of money that you would need to pay before your insurance will pay a claim on your behalf. And the plan year, so there's 2 different plan years in effect here. Your student health plan has a plan year that goes from 8/1 to 7/31. And your dental plan has a plan year that starts 9/1 and goes to 8/31. So they don't exactly line up. All right, so this year we have our dental plan with Altus Dental. We're super happy with Altus. They've been very good to us and our members. And we have an 80% benefit for oral surgery, which is what removal of wisdom teeth falls under. 80% means that the plan would pay 80% and you would pay the remaining 20%. There's a couple of important things to note. So there is a deductible if you go out of network for Altus. So if your dentist does not accept Altus, you would have a deductible of $75 before the insurance would pay a claim on your behalf. That deductible occurs every plan year. So if you've already paid your deductible in October, and you get your wisdom teeth removed in February, you wouldn't need to worry about your deductible. But if you hadn't met your deductible yet, that would come out before the insurance claim would be paid. The dental insurance does not require that your wisdom teeth be impacted. So impacted would mean they haven't erupted through the gum line. Typically, the reason you would have problems in the first place with them is that they would be growing in sideways or not coming fully through the gums. So with Altus, it doesn't matter whether they're impacted or not impacted. That's not a relevant issue with this coverage. Altus in-network dentists, like we said before, in-network dentists are going to have the lowest rates. Out-of-network dentists may balance bill you. So that's why we really push you to go with an in-network dentist, because that is going to make your cost the lowest. And the maximum benefit payout for each plan year would be $22.50. Typically, that is plenty for our members. We rarely see members who are bumping up against that plan year maximum each year.
We have a question.
Yeah, I'm going to pause. Yep.
So someone asked, if my dentist is out of network for Wellfleet, can I still ask them to build a claim? Do I have to pay first and get reimbursed afterwards?
Mary Jo, do you want to address that one?
So if the provider does not participate with Wellfleet, you can still have them build the claim directly to Wellfleet. The benefit under our plan is 95% after your $200 deductible. Again, we don't have a list of participating dentists. We do use Cigna. There are some oral surgeons that participate with Cigna. To answer your question, but yes, the claim can be submitted directly by the dentist and you should not have to pay out of pocket.
Mary Jo, have you ever seen a dentist refuse to do that? That's a very rare occurrence, right?
No, yeah, not with the wisdom teeth. For regular dental sometimes, but not for wisdom teeth.
And in like a worst case scenario situation, a member could submit the claim themselves, right?
Correct, yes.
Okay, but very atypical. Typically, your dental office will be willing to submit the claim. Typically, what I see is not a willingness, is not a lack of willingness to submit the claim, but a lack of understanding of the dental office that you have these two insurances in play, because it's not typical for most employees to have two lines of coverage for their dental work. Typically, people have one dental plan. So I think what typically trips up dentists that I've seen is they're like, wait a minute, there's two plans. So that's why we're explaining it to you, so that you can also help explain it to your dental office if there's confusion. And we're totally happy to talk to your dental office to explain. And also every year we send out a letter to the local dental offices that our members really frequent, sort of explaining this, just to prime them for the questions that do come up.
That's a great idea. I like that.
We try, because it just is, it's more expedient to answer the question once than to answer it 1,000 times. So we sort of already touched on this, but we just talked about your Altus plan. Your student health plan insurance is separate and in addition to it. And there is a 95% coverage for removal of impacted wisdom teeth. You do have to meet your deductible first. Mary Jo, do you want to touch on that deductible?
The deductible is $200 per policy year. So remember, the policy year starts on 8/1/2022 through 7/31/2023. So each policy you'll have a new deductible.
And the coverage, again, is just for impacted wisdom teeth. If they're not impacted, they wouldn't be covered, correct?
Correct. Yeah.
They would be covered by the Altus Dental Plan, but not by the Student Health Plan. Most of you, if you're having issues, are going to have impacted wisdom teeth, but that does need to be verified by the dentist. And like Mary Jo said, we have a list of dentists at the end that we're going to give you. you don't have, if you're primarily using the student health plan because your teeth are impacted, you don't have to be super careful about the dentist you choose, but the ones that do accept Cigna may have lower negotiated rates. So it may make a small difference to choose one that is in network for Cigna. Oops. Okay, so we tried to create a decision tree for folks because it does get really complicated, and we tried to really strip it down. So the first question again that you need to ask yourself is, are those wisdom teeth impacted? If you know that they are because you've already been to the dentist and you've had your x-rays done, then you're kind of going the route on the left, which is you can choose really any dentist because the primary insurance really is going to be that student health plan at that higher 95% coverage rate. And you'll bill it to your Wellfleet insurance first. Your deductible does have to be met first, that $200 deductible. And then the remaining bill can also be covered by your Altus Dental insurance. So that covers removal of wisdom teeth at 80%. So in the end, after both of your insurance policies are billed, you should see a very low balance for yourself because you've got two lines of coverage that are in play. If you're not sure if your wisdom teeth are impacted, you just are having trouble, you need to start by setting up an appointment with a general dentist and getting your exams and your x-rays, or maybe you'll need a problem-focused exam because you've already had your regular exam. Either way, you're going to be at a general dentist to identify what the issue is as a starting point. And then the best bet would be then to go back to the start now that you know whether your wisdom teeth are impacted or not, and follow the pathways. If you do not have impacted wisdom teeth, like we've said before, your best bet is going to be to choose a dentist that's in network for Altus, because Altus is going to be the only plan that's going to be providing coverage for you. So that's going to be at that 80% level. Picking an in-network dentist is going to be the best bet, and you won't see a deductible if you pick an in-network dentist. I'm just going to pause to see if folks have anything they want to add or if there's any questions. Okay. So this is a very short list of just a handful of dentists that we pulled together that are local and provide oral surgery. Just a couple of notes. At the end of the session, we're going to give you two lists. One is the list that UHS gives out, and it has a very long list of dentists. We're also going to give you in-network Altus Dental dentists, that list. So you'll have a bunch of dentists to look at after this session. This is just a small list of oral surgeons that are nearby to where you might live. And what is going to be helpful for you is, once you know your situation, do I have impacted wisdom teeth? Do I not have impacted wisdom teeth? Is to check whether these dentists take Altus, because that is going to be your best bet. If you can find an Altus dentist, you always want to stay in network if you can. All right. So this is something that is not very intuitive to some folks. Like some folks feel that if they're in the dentist's office, they need to listen to the dentist and just do whatever the office is suggesting. But we do want to advocate for you being an assertive patient, asking questions, making sure that your insurance is being utilized to the fullest. So you don't need to feel that you're a passive consumer at the dentist. You can be an informed consumer and make decisions that are in your best interest, which is not to say that you should be questioning the dentists about their professional knowledge, but just that you can be your own advocate and you can ask questions and make sure that someone is representing your best interests. So what that looks like is making sure that the billing office has the information for both of your plans, the Wellfleet and the Altus. asking that your bill be sent to your health insurance first and then to your dental plan. And if someone is questioning that, saying, no, our health insurance plan does have coverage for impacted wisdom teeth, that's why I'm asking for this. That's all perfectly reasonable to assert at the dental office. And then and this is very rare, but if the dentist doesn't seem to be sort of on board for working with you and making sure that your insurance is used to the fullest, then you can choose to use a different dentist. Again, it's very rare, but I do recommend advocating for yourself in any healthcare situation. And part of that self-advocacy is asking for a pre-treatment estimate. So I'm going to let you cover this, Keith or Diana, but just in preface to it, asking for a pre-treatment estimate is typically totally able to be accommodated, because typically it's not an emergency situation where your wisdom teeth have to be removed on the spot. Typically this is something that gets scheduled out, and there's plenty of time for a pre-treatment estimate. So I'll hand it over to our Altus folks to explain what that is.
Yes, thank you. Again, we encourage wise consumerism, right? And we're dealing with a pretty heady crowd here, I believe, very educated. And you have to think of the anatomy of a visit in this case. And Leslie brought up a good point earlier, where it's typically going to be a problem-focused visit, probably because there's the known issue of the wisdom teeth, or it might be a specialist consultation, at which point they might refer you, or they may plan to do the procedures for you, in which case you always ask that they submit a pre-treatment estimate to Altus Dental. That way you know how it's covered and what it's going to ultimately cost you. There's a lot of efficacy standards underneath. However, most folks are really interested in what it's going to cost them. So it gives guidance. Those pre-treatment estimates are good for a year. Sometimes people kick the can on this procedure because people aren't looking forward to it. And I think right now, if you're on this call, you might have issues that way, and you're in a natural break where it may be time to do it and get it done. The pre-treatment estimate is good for a year, and it has to be performed by the provider that submitted it in the first place.
Perfect. Tita, I think we should take the question that's in the queue too. Yeah. I think it's.
The question is, they call Connecticut Valley Oral, but they say they didn't take Altus.
Yeah, so Connecticut Valley Oral Surgery is the closest oral surgeon to most folks at UMass. They don't take a lot of dental insurance plans. In fact, I've heard that they don't take any at all anymore. But what's important to know is that your Cigna plan, if your wisdom teeth are impacted, your Cigna plan will pay 95% of that bill at oral surgery, Connecticut Valley Oral Surgery. They don't have to be in network for Cigna for you to get that coverage. So that's why we put them on the list. So again, this is part of being an active, assertive consumer. You need to determine for yourself, if your teeth are impacted, you're going to get that 95% coverage at Connecticut Valley. They're not going to be in network for Altus. You need to make sure for yourself that that is a decision that you want to make. And for some people, the convenience of having a dentist in Amherst where they can get the oral surgery done, because they will probably need a ride home after the surgery, they have a friend who's nearby, the convenience of that outweighs the amount that Altus will be paying after 95% is already covered, that 80% of the remaining bill. For some people, that is they're willing to say, okay, it's fine that it's not in network, and then I'll lose a little money there because of the convenience. It's something that you have to weigh for yourself. If you are very conscious of how much you want to spend on this plan, and you have transportation and you have someone who can come pick you up, I would recommend going to one of the oral surgeons in Holyoke or Chicopee that are in network for Altus. That will really maximize your benefit, because you'll get, if you have the impacted wisdom teeth, you'll get the 95% from the student health plan, and then you'll get the 80% from Altus. You'll be in network. There won't be a deductible there. That would be the way to fully maximize your plan. But again, these issues are very specific to the individual. If you have no way to have transportation to Chicopee, you have a different decision to make. All right, so we have a couple of sample breakdowns of what a situation might look like when you need your wisdom teeth removed. I wanna just preface that by saying, like I just said earlier, everyone has a different situation. Some people's surgery will be more complex than others. These are just scenarios to give you a rough idea. And what we really recommend is that if you know you need to have your wisdom teeth removed, you contact Altus customer service to get a better sense of how to coordinate these two lines of coverage that you have. And they are happy to help. They're very responsive. So definitely reach out, and that can be in addition to requesting that pre-treatment estimate, which also would engage Altus to look at the procedures and look at your plan and tell you what will be covered. So scenario one, you go to see a dentist that's in network for Altus. You not yet met that $200 deductible for your student health plan. Let's say you haven't used your student health plan at all this year, and your wisdom teeth are impacted. So this is a situation where you definitely want to give the dentist your Wellfleet student health insurance information because those teeth are impacted. But you will be experiencing that deductible because you haven't paid it yet. So Mary Jo, do you want to walk us through what that would look like under Wellfleet in this hypothetical scenario? I think you're muted. Sorry
about that. So the oral surgeon charges $4,200. Wellfleet deductible is $200. So we take the $200 right off the top of the $4,200, and that leaves a balance of $4,000. And then we pay 95% of $4,000. Is that correct? And
yes.
That comes up to the $3,880. So the grad, after Wellfleet processes the claim, will be responsible for $400. So then you're going to submit that to Altus.
Yeah, and again, Altus should be involved in this process, and they will work on coordinating your benefits with you. But if you give that dentist both plan information, your cards for both plans up front, they can also be involved in shepherding this through. So in this situation, then what would happen, Keith, once the student health plan has been billed for this person?
I'll let Diana speak to that.
Okay.
So once Wellfleet processes the claim, the dental office will make a copy of that explanation of benefits and send it to Altus, so we then can coordinate the benefit between the medical and the dental policy. So it's not so much the balance, but we will need to see exactly how Wellfleet process each line item and with the deductible applied and all that. So most oral surgeons are well versed on the process of how to submit the claim between medical and dental. So they know that all impacted would have to go to medical first and then submit a copy. They have to wait till the medical processes that claim, and then they'll submit a copy of that explanation of benefits to the dental carrier. It's a pretty standard procedure.
Yeah, it's a process, and that is something that I want to emphasize for folks too, because you will start getting an explanation of benefits in the mail, and it says right at the top, and we'll show you an example. This is not a bill, and part of the reason it says that is this is a process. So it has to be processed by your medical first, then it has to be processed for your dental. And so don't be alarmed when you start getting paperwork about it, because the process is going through the steps and you might not be at the end of the process yet. So don't be alarmed when you see numbers, but it says this is not a bill.
Yes, I might add, it's very beneficial to pick up the phone and call customer service. They are responsive, as Leslie said. And I just think being totally engaged in your care, being a smart consumer, like whether you're buying an iPhone, a computer, home equipment, I just want you to use those same habits when you're consuming dental and medical benefits, essentially.
Yeah, I couldn't agree more. And also just keeping the communication open is super important. When your dentist doesn't know that you have two plans, that is usually the fault of tons of problems then that roll out from that starting point. So just being super communicative with your dentist, saying you have these two plans, can really set you on the right path. All right, so in the second scenario, you see a dentist that is in network for Altus, but your wisdom teeth are not impacted. So this doesn't happen very often, honestly, because usually the teeth are impacted. But in this case, like we said before, Wellfleet wouldn't be applicable because they cover the teeth when they are impacted. So you're gonna go, Mary Jo, yes, please jump in.
I was just gonna say, a non-impacted tooth is a tooth that has erupted over the skin, and it's like growing like a normal tooth, right? But if it's slightly erupted, but it's sideways, growing sideways, that's still considered impacted. It's only really if it's fully above the gum.
Right, and you likely wouldn't even be experiencing any issues if your tooth is erupted with no issues. So you wouldn't really even be here contemplating removal. So that's why I say typically what we see is that people have impacted wisdom teeth. That's why they ended up in the dentist. They have pain, their tooth is growing in sideways, all that stuff. So in this case, you're going to go straight to Altus. You're going to make sure that the dentist has your Altus plan information. In this case, it's important that you're at an in-network dentist for Altus because you're really going to want to maximize that plan. It's the only one that's covering you. So in this example, the oral surgeon charged $1,575. You don't have a deductible because you went to an Altus dentist. In this situation, there might be a couple of things that aren't covered, and they would be noted as notes in the explanation of benefits. So in this case, we deducted $275 for something that wasn't covered, and then the dentist would have negotiated rates with Altus because they're an in-network dentist. So the plan is going to pay 80% of that negotiated rate, and you would be responsible for the exception that wasn't covered plus your 20%. I'm going to show you an example of what one of these, I'm going to skip a slide and show you an example of what we're talking about. So when you start receiving care from the dentist, you're going to be getting an explanation of benefits. And like I said, this is a process. At the top, again, this is not a bill because it's not your final statement. It's a statement of what has happened so far and what the insurance has applied so far. So this is an explanation of benefits from Altus, showing that there was guided tissue regeneration. That was what was not showing up as covered in the previous example. And then there was an extraction, and then there was anesthesia. So the kind of relevant categories here of information: the dentist's charge. So that is what it says it is. That's how much the dentist charges for that procedure. There's the allowable charge, which is the negotiated rate with Altus for that procedure. You're in network. So that is in essence what you're going to be charged because you're in network for Altus. And then there's the coinsurance, which is the amount the insurance is going to pay for that procedure. So in this case, 80% coinsurance. You see the balance that's left and the plan payment. Plan payment is what the insurance is going to pay on the claim. So important to note, I often get panicked calls because something says it's not covered. One important thing is going to be to look at the note here at the bottom that says why the issue was not covered. So you see the 721 and the processing policies. If there is a a number there and something doesn't look like it's being covered and there's a note at the bottom, that's going to help point you in the direction of why that item is not being covered. Sometimes it will be because the plan just doesn't provide coverage for that procedure. Sometimes it will be that the plan needs more information to cover that procedure. Very important. So your dentist will also have received that and they'll know that the insurance company needs more information in order to process that claim. So again, it's not the final verdict necessarily. It could just be a request for more information. I'm going to just pause and see if anyone wants to add anything or if there are questions. Okay. Oh, it looks like there is a new question.
Someone asked, I have a pre-treatment estimation showing local anesthesia not covered.
Who wants to jump in on that?
Is it from Altus?
I'm going to assume, yes, Altus.
So it could be that if the tooth is not considered a surgical procedure, like this example, the procedure code 7210, if it is not considered a surgical procedure, then anesthesia is not covered in conjunction with that. So if it's considered a simple extraction of fully erupted tooth, the anesthesia will not be covered in conjunction with that.
And Mary Jo, there wouldn't be any additional coverage for anesthesia if, well, there, can you explain whether there would be coverage for anesthesia in this case from the student health plan perspective if there's an extraction of an erupted tooth?
If we cover it, I'd have to pull up the plan document. So can we just, until I pull that up?
Let's defer. Yeah, let's defer that question.
Leslie, can you send me the members' information? I can take a look at their pre-treatment estimate directly and just confirm that what I'm saying is correct.
Yeah, no problem. I'm assuming that's okay with the person who asked the question. Let us know if it's not okay for me to send your name, but I'm assuming it will be. All right, so while we're doing that, I'm going to skip to the next explanation of benefits sample to just give you a peek at what that looks like. So this is a different set of procedures. This is removal of 4 impacted wisdom teeth. So those are each listed at the beginning here. And then general anesthesia, it looks like 30 minutes, 45 minutes of general anesthesia. Sorry, did someone want to jump in?
No.
Okay. So again, you're going to be looking at the dentist charges, the allowable charge, the coinsurance amount, which is 80% under your Altus plan. The balance is going to be what's left over after this plan pays, and the plan payment is going to be what this plan pays on your behalf. All right. So I'm going to switch gears here. So I just want to make sure that we have covered everything we meant to cover with EOBs first. I think we're good. So one thing I really recommend to members is creating your account on the Wellfleet site and on the Altus site in advance of any use of your plan, because that's just going to set you up for success, because you have access to so much documentation in your account portals with them, and you won't have to be fiddling with that when you're in a situation where you're like, oh, I have to go to the dentist tomorrow and I don't know any of my information. So I recommend just doing it now while you're thinking about it, and then you're done. So for Wellfleet, you'll go to wellfleetstudent.com, or I've given you the secondary page from that starting point here. And you'll look for that little 3 lines that look like a hamburger. Under that, you'll go to account, graduate, create a new account. You'll set up your account. Is there anything specific, Mary Jo, that someone would need to set up that account?
The Wellfleet account, all they will need is their date of birth and the student ID number.
Perfect. And then on altusdental.com, you can set up your account as a first-time user. This is the image of what it looks like for the member online registration. You will need your unique Altus ID number, which is in your portal with us. And Tita, do you want to put our portal address in the comments so that we can get that to everyone? So you'll just log into your portal with the trust fund, go to your dashboard, and you'll find your Altus ID number. We can also send it to you if you need us to. You can email us and we can get it for you.
Leslie, there is on our website, if they do not have their ID number, it still allows them to register. There'll be a button that says, if you don't have your ID number, click here. Some type of language like that.
I did not know that. That's great. Awesome. Okay. And then there are lots of things that you can do on the Altus site after you've registered. Keith or Diana, do you want to walk us through what you have access to?
Sure. Again, practicing good consumer habits. All the functionalities of the dental plan are right at your fingertips online. When you register, you can print an ID card if you look at the middle top, which is great. Take a snapshot for your phone, send it to dependents, what have you, because you'll want access to an ID card sooner or later. And find a provider in network. And the one I'm kind of partial to is middle bottom is view your deductible and maximum amounts, confirming remaining balances. It's kind of like a living summary. It's almost live. There's a little bit of a lag, obviously. And it'll show you how many cleanings you might have this policy year. Remember, you've got 4, which is incredibly robust. How many exams you'll have left, where you are with respect to your annual maximum of $22.50. It's especially if you're gauging where you're at, if you're expecting perhaps a wisdom teeth extraction, so on. You can also opt out of paper and view all your EOBs and whatnot online as well. So all functionalities of the plan are right available to you there.
Yeah, we very much encourage registration on our website. As you've been saying, Leslie, you have to be a self-advocate, and offices are not required to look up your benefits and know what is covered, what is not covered. That's your responsibility as a member and a patient.
Yeah, I can't stress it enough. Like, even if you have the most lovely dentist office in the world, it's not their pocketbook that this amount is coming out of, it's yours. So ultimately, you're going to be the one that is best able to advocate for yourself about whether you're going to be maximizing your benefits and reducing your costs as much as possible.
Can I go back to your question?
Yes.
Okay. So with the Wellfleet dental plan, with the extraction of the wisdom teeth, as long as they're impacted, the anesthesia would be covered as well. If you get into the simple extractions, that would actually fall under the pediatric dental, which is up to age 21. So if there's a simple extraction and the student is under age 21, or the grad, excuse me, then we would also cover the simple extraction and anesthesia.
Oh, that is really important to note. And I'm so glad you brought that up. That's another ripple in this whole thing, which is there's a pediatric benefit, dental benefit on your student health plan if you do fall in that age range of under 21. So, and it complicates matters, and this is why. So sometimes, and I've seen it happen actually quite a bit, dental offices will look at your Wellfleet plan and see that pediatric dental benefit and go, oh, you don't have any dental benefits under this plan. It's only pediatric. And if you're over 21, it doesn't apply to you. And you have to then say, no, we also have an impacted wisdom tooth benefit.
Right.
So that happens quite a bit. And that's an example of what I'm saying in terms of advocating for yourself. If the dental office keeps saying, no, and I've seen this back and forth, no, it's just pediatric. And you have to go, no, there's this other part. Here it is. Show it to them. So it's part of the, of standing up for yourself and asserting what you know to be true about your plan, because these folks deal with 1,000 different plans all day long. And so it's nothing against them. They see the pediatric and they think you're confused. So you just have to say, no, there's another part to that. Thank you so much, Mary Jo, for bringing that up. So just to review the highlights of what we talked about today. Important to determine whether your wisdom teeth are impacted or not. Important to request a pre-treatment estimate. Important to give your dental office your Wellfleet information and your Altus Dental information. And important to ask questions and advocate for yourself and call us if you need help. You can use us as a starting point, or you can use Altus as a starting point to connect with customer service, or you can use Wellfleet as a starting point and connect with their customer service. We're all here to help you navigate this path. And toward that end, I've given you all of the contact information for both plans. And then Tita has also put our contact information in the chat. This will be something you can take away with you from today. We'll send you all these slides so that you have all of the contact information at your disposal. And then we've also given you your group numbers so that you have it all in one place. So I think that was what I was hoping to cover today. I'm going to open it up and see if there are any more questions, and also if panelists want to jump in with anything we may have forgotten. Tita, I think there's a question.
So the question is, do you have to request submitting claims to Wellfleet and Cigna separately? And I think they meant Altus.
Yeah.
I think as long as they're providing both identification cards, the dentist is going to know you have two insurances, so it should be automatic. Depending on the procedure, if it is your wisdom teeth, you want to have them bill it to Wellfleet first.
I think, yeah, Diana, I was going to say, I think you kind of summarized this well earlier, if you want to do that again.
Yep. So on the pre-treatment estimate, if that was, I think that was the question, correct? It was related to pre-treatment estimate.
I think it was about submitting claims. What, like, do you have to submit them separately?
Yes. So you have to submit it to your medical first, and then the office will send a copy of that explanation of benefits from your medical to Altus Dental. But as far as pre-treatment estimates, we do not coordinate benefits on an estimate, on a pre-treatment estimate, because it's just an estimate. So if a pre-treatment estimate is what you want to do first, you can have them sent to each policy at the same time. And it will be an indicator on our pre-treatment estimate that those specific codes, if they're impacted, would be required to be billed to your medical first once you go ahead with the procedure.
So basically, is it correct to say that, let's say someone completely forgets about their Wellfleet and they go to the dentist and they have their wisdom teeth removed and the claim is sent to Altus, is it safe to say that Altus will say, hang on, there's a health plan potentially?
Absolutely. Yep. There'll be a processing policy of 58 that will indicate that it's required to be billed to your medical first if it's impacted code.
So there's kind of a fail-safe in place if you forget.
Yes.
Then the claim will go back to Wellfleet. Wellfleet will address their portion of it, and then the Altus can kick back in. It's cleaner if you know this from the start, though, and you give everyone all the information up front. It just prevents a lot of back and forth for you and for everyone. Any other points we want to get out there or questions to answer? Okay, I think this was a really helpful presentation. Thank you so much, Keith and Diana and Mary Jo. And thank you, Tita, for keeping us on track with the questions. We're available to answer these questions after the session as you proceed, and this issue might crop up for you. There's plenty of information on our website. There's a whole page devoted to wisdom teeth, and we will send you everything we referenced after the session. If you come up with a very detailed question after today, schedule a one-on-one help session. We'll bring in Keith and Diana and Mary Jo on the side if we need help answering your question. But there's always time to ask these questions going forward. And if you were the winner of one of our gift cards today, we will email you after the session. Anything else I've forgotten, Tita? All right. So thank you so much to everyone. Have a great rest of your day. And we will be in touch with getting all this information to you by email.
Thanks very much, all.
Nice to meet everybody. Bye.
Bye-bye now. Thanks.